First wave of COVID pandemic, they stopped as a law. Many, societies, many governments have stopped home care physiotherapy, like physical contact between the caregiver and the patient. So, actually, unfortunately, many of my patients, they had spasticity and contracture because there was no one to help them. Many apartments never used to allow physiotherapists inside, and even the healthcare workers, the physiotherapists themselves were very scared to go to give bedside care to the patient. Suppose there are two types of physiotherapy. One is active and passive. Active physiotherapy means it's like a Zoom meeting. You just guide them how to do. That is possible only if the patient is having a good power, good reasonable strength, and he is able to ambulate himself. So in such patients, yes, guiding them telephonically or by video consultation, or maybe once in a week you call them for a checkup, just give some task, so you keep that going. So that's easier, and that is largely for patients who are ambulatory. But here the main problem comes wherein we have a good lot of patients who are bedridden and they need bedside. So there is no way that a caregiver cannot come or can come only virtually. So here what we generally recommend is to avoid lesser exposure. We ask them to go either on alternate days or weekly twice, and they actually, if there is any family member who can volunteer to do physiotherapy for them, we teach them how to do, and therein actually we can help them, so the risk of infection is lesser. Third thing, earlier we used to do COVID RT-PCR on all the healthcare workers, especially during first wave, regularly, at least once in 2 weeks or once in a month. And we used to, all these rehabilitation centers, we used to ask them to do RT-PCR testing for the healthcare workers. But definitely after taking, I think most of the healthcare workers are vaccinated with both the doses now. Most of the physiotherapists are vaccinated, at least my center, everybody is vaccinated. So that risk is lesser. But as you said rightly, we need to be very cautious. We need to choose patients who are for physiotherapy, avoid direct exposure to the patient as much as possible. At the same time, we cannot neglect the physiotherapy aspect of it, because that's very, very important.
Yes.